The top stories tonight in Y News. The Philippine government is studying the appeal to place several provinces in the Bicol region under enhanced community quarantine.
Mindanao Solon insists the unfair distribution of COVID-19 vaccines in the provinces.
A senator wants the executive department to utilize the unspent Bayanihan fund. A health official says that people working or walking in open-air settings do not have to wear face shields.
The Quezon City government opens a COVID-19 vaccination site after working hours.
And a fully unmanned ship prepares for transoceanic expedition. Good evening, Philippines and the world. Today is Wednesday, June 16, 2021. I am Harleen Delgado.
Join us in the next hour as we deliver today's top stories around the country and other parts of the world. I'm Angelo Castro III.
We are also seen in 1,935 satellite monitoring centers nationwide and via live streaming worldwide through the UNTV News and Rescue social media accounts and our website, untvweb.com. I am William Theo.
First in the news. The government is looking into declaring a more strict quarantine status over 3 provinces in Bicol region amid the COVID-19 surge. Medical groups in the region worry that the cases may get out of control. Rosa Licos will tell us why.
Several Bicol region medical groups have sent a letter to the Department of the Interior and Local Government or DILG appealing to place the provinces of Albay, Camarines Sur and Sorsogon as well as the cities of Legazpi, Naga and Sorsogon under Enhanced Community Quarantine or ECQ. In a joint letter, groups attributed the COVID-19 surge in the region to laxity in the implementation of the minimum health protocols. Some local officials allegedly have also disregarded IATF regulations set by the DILG, slow, inaccessible, and inadequate testing and much slower and poor contact tracing efforts, among others. According to DILG spokesperson Undersecretary Jonathan Malaya, the request is being under study. DILG is also meeting with the Department of Health for their recommendations regarding the issue. Based on the data of the DOH, there are 2,349 new COVID-19 cases in Bicol region for the last 14 days. Albay, Camarines Sur, and Sorsogon are the top cities with highest new COVID-19 cases, followed by Naga City and Masbate Province. Currently, Naga City is the only area placed under Modified Enhanced Community Quarantine or MECQ until June 30, 2021, while majority of the Bicol region is under Modified General Community Quarantine or MGCQ, the least strict quarantine restrictions in the Philippines. Rosa Licos, UNTV News and Rescue. We serve the people, we give glory to God.
The Philippine government is looking to expand its COVID-19 referral center into other regions to improve coordination among local authorities and healthcare providers amid rising infections in various parts of the country. During the Laging Handa public briefing, Health Undersecretary and Treatment Czar Leopoldo Vega said they have established regional hospital commands in Regions 4A, 3, and in Southern Mindanao and Caraga areas. The One COVID-19 Referral Center, previously called One Hospital Command, connects patients needing medical attention to healthcare providers. Its headquarters is in Metro Manila. Those in need of medical help may call the One COVID-19 Referral Center through hotline 1555 02886 50500 0919 977 3333 or 0915 777 7777.
Meanwhile, a Mindanao Solon refuted the statement of presidential spokesman Harry Roque that the government implemented equitable distribution of vaccines and Mindanao was not neglected. According to 2nd District Cagayan de Oro City Representative Rufus Rodriguez, few vaccines were allocated despite a COVID-19 surge in some parts of Visayas and Mindanao. Nel Maribohok explains why.
his basis for that there is the rule of equitable distribution is not true. It is not based on the fact.
This is the reaction of 2nd District Cagayan de Oro City Representative Rufus Rodriguez to presidential spokesman Harry Roque's statement that Mindanao was not neglected in the government's pandemic response, particularly in the distribution of COVID-19 vaccines. According to the lawmaker, they are not against when the government prioritized the vaccine supply in Metro Manila and nearby provinces due to rising COVID-19 cases. But he said the government did not deliver enough vaccines in some parts of Mindanao and Visayas where COVID-19 cases were reportedly increasing in May.
What can be equitable is if you give to areas in need. Equitably would mean according to the need. Okay. So it is the high incident cities that require that has the need. And so therefore, the premise that he has that there is equitable distribution is not true.
Deputy House Speaker said Cagayan de Oro City received a total of 35,000 doses of COVID-19 vaccines last Monday. This is much higher compared to the previous 2,000 or 3,000 vaccine doses per deliver of the government, but according to him, this is not enough to inoculate the 700,000 population in the province. He said he will insist in the next hearing of the lower house of what is really the plan of the national government in the vaccination rollout. The congressman will propose to assign also a cabinet member who will monitor the situations in Visayas and Mindanao, just like the administration did to NCR+.
We should have now a cabinet member to monitor. One cabinet member for Mindanao and one cabinet member for Visayas and one cabinet member yung outside NCR and plus A.
Secretary Roque has yet to comment on the statement of the lawmaker. But Vaccine Czar Carlito Galvez Jr. reported last Monday that they already comply with President Duterte's instruction of redeployment of vaccines in high-risk areas.
Yung lahat po na may underline, nag-deploy na po tayo ng mga vaccine ng Sinovac and also some vaccines ng AstraZeneca dito sa mga regions po nito. In order to address yung increasing surge ng mga area from Mindanao and also in areas of Luzon and also Visayas.
Nel Maribuhok, UNTV News and Rescue. We serve the people, we give glory to God.
More and more cities in Metro Manila have started vaccinating indigents or the A5 priority group against COVID-19 as the immunization program expands further. Janice Inhente has this story.
Indigent residents of Mandaluyong City flocked the vaccination centers today. Residents belonging to the A5 sector received their first dose of Pfizer COVID-19 vaccines. Almost 4,000 indigent residents were inoculated in the city.
Mas dumagsa, mas dumoble yung mga tao. Mas marami ngayon ang A5, dumagsa na sila at the same time Pfizer. So yung prefer nilang gamot na Pfizer, kaya nagpupuntahan sila. Kahit yung wala sa listahan, nagpupunta na.
Mandaluyong City has 30,000 doses of Pfizer COVID-19 vaccines allocated to the A5 group as well as senior citizens and persons with comorbidities. Mandaluyong LGU strictly reminds that walk-in is prohibited except for senior citizens.
Para po hindi kayo mahirapan, siguraduhin kayo ay naka-registered online sa ating Mandavax. At kung hindi hirapan po kayo, humingi kayo ng tulong sa ating barangay chairman para kayo mismo ay matulungan.
Meanwhile, in Manila, the city's priority is to vaccinate indigent residents in 8 places. These are in Punta Santa Ana, Baseco, Port Area, Parola, Happyland, Temporary Housing, Katuparan, and Smoky Mountain.
Basta, taga rito kami, alam namin kung sino mahirap eh. Ako na magsasabi sa inyo, lumabas kayo ng eskwelahan ito, magturo kayo sa akin na mayaman dito. So lahat to considered A5, ang taong Baseco. Kaya yung kwento ko sa inyo kanina, based dahil ako yung pinanganak sa Maynila, lumaki sa Maynila, and 23 years na ako naglilingkod sa pamahalaan. We know where the majority of A5 is located.
Janice Inhente, UNTV, News and Rescue. We serve the people, we give glory to God.
A lawmaker is urging the executive department to hasten its use of billions of unspent funds before a Senate panel tackles the proposed Bayanihan 3. Arlene Delgado will tell us why.
Exactly 2 weeks from now, the unspent funds under the Bayanihan to Recover as One Act, also known as the Bayanihan 2, is set to expire. During the Senate Committee of the Whole hearing yesterday, the Department of Budget and Management says over 173 billion pesos have yet to be obligated by implementing agencies, citing projects and programs that are not yet due and demandable. The law was extended from its original expiration of December 2020 to June 30, 2021, after lawmakers lamented the slow spending of some government agencies. That is why Senate Committee on Finance Chairperson Sonny Angara is calling on the Executive Department to speed up in utilizing the budget allocated to them by Congress before they could tackle the proposed multi-billion Bayanihan 3.
Sana yon between now, it's June 16. There's 2 weeks for the month and yun talagang period nila to really paspasan nila yung disbursement of the money.
Health Secretary Francisco Duque III has asked Congress to possibly include in the Bayanihan 3 a supplemental budget of 66 billion pesos to augment the COVID-19 war chest to be used mostly for compensation and emergency hiring of health workers. However, Angara says he has yet to receive a formal communication from the Health Secretary regarding the request. Finance Secretary Carlos Dominguez, for his part, said the DOH budget and the proposed measure should be discussed separately.
I want to know the reasons why they said that. Siguro they want to tackle the health problem separately from the stimulus problem. Although maraming senators naman gusto pag-usapan yan together dahil that's all part of the COVID response. No?
Angara plans to tackle the two similar bills once session resumes in July. Earlier this month, the House of Representatives passed its version of the bill with a 401 billion peso allocation. However, the palace has yet to certify the bill as urgent. Last month, presidential spokesperson Harry Roque said the palace is still awaiting an advice from the economic managers if there are available funds for the proposed measure, which aim to provide aid to Filipinos who are greatly affected by the pandemic. Arlene Delgado, UNTV News and Rescue. We serve the people, we give glory to God.
For those watching our 24/7 live streaming on YouTube, please click the subscribe button you see on your screen and ring the bell for notification. You may also follow us on Facebook.
The U.S. Centers for Disease Control and Prevention has declared that the dangerous new variant first discovered in India as a variant of concern. Aiko Miguel will tell us why.
The designation of variant of concern is given to strains of virus that are considered to be more transmissible and cause more severe infection to an individual who is positive of COVID-19. According to the U.S. Centers for Disease Control and Prevention, the Delta variant decreased the effectiveness of public health and social measures or available diagnostics, vaccines, and therapeutics. The Delta variant, aside from causing the surge in India where it is first discovered, is also believed to be causing the surge in the United Kingdom. According to Health Undersecretary Maria Rosario Vergere, the Delta variant is 60% more transmissible than the Alpha variant first discovered in United Kingdom.
Yung UK variant po, nung unang lumabas, sinabi nila na ito ay 60%, 50 to 60% more transmissible. So yung existing po na variant natin ngayon for SARS-CoV-2, dadagdagan nyo ng plus 60% more transmissible, talagang mabilis po ang pagkakahawa-hawa. Pero nung lumabas ang Indian variant, it's 60% more transmissible than the UK variant. So it means with the existing variant that we have on top of UK, and then there's Indian variant, sobrang bilis na po ang pagkakahawa-hawa.
The DOH also reports that 90% of the variants in UK are Delta. As of May 26 here in the Philippines, there are 13 Delta variant cases. 2 of these are returning overseas Filipino workers with travel history to India. The country has also implemented a travel ban on India and 6 other countries with Delta variant cases, effective until June 30. It was on May 10 when Delta variant has been included in World Health Organization's list of variants of concern. The health department has been repeatedly reminding the public to observe minimum health protocols to cut COVID-19 transmission and prevent the spread of the COVID-19 variants anywhere in the country.
Lagi nating tatandaan, variants are produced because there is a host. Kapag mataas ang kaso, mas maraming pwedeng mag-mutate na virus, mas maraming variants na ipoproduce. Pero pagka na-maintain natin na mababa ang kaso, kakaunti lang ang kapasidad ng virus para mag-mutate pa siya at mag-produce pa ng further variants.
Meanwhile, the DOH has not yet confirmed whether the dominant COVID-19 variant in areas in the country with COVID-19 surge is Delta. Aiko Miguel, UNTV News and Rescue. We serve the people, we give glory to God.
And the Philippines has recorded 5,414 new COVID-19 cases, bringing the nationwide tally to 1,332,832. In its latest case bulletin, the Department of Health reported 7,637 patients recuperated from the virus, bringing the total number of recoveries to 1,253,541. COVID-related deaths climbed to a total of 23,121 with 158 new fatalities. The DOH also said the country's number of active cases has reached 56,170. Of these cases, 91.4% are mild, 4% are asymptomatic, 1.36% are moderate, 1.9% are severe, and 1.3% are in critical condition. The DOH, however, noted its report that 6 accredited testing laboratories failed to submit data on time.
Of Labor and Employment is carefully studying a plan to increase the deployment limit of healthcare workers abroad. Labor Secretary Silvestre Bello III, however, assured that the country will not run out of nurses amid the pandemic. Ray Pelayo explained why.
The Department of Labor and Employment, or DOLE, mulls increasing the cap on the overseas deployment of healthcare workers to 10,000 from the current 5,000. DOLE Secretary Silvestre Bello III said the plan is now under study as the country has an adequate supply of nurses and healthcare workers.
Naniniwala po na right now we have enough number of nurses, kaya I'm willing to recommend na itaas yung deployment cap from 5,000 to another 5,000.
Bello stressed, however, that the decision still remains with the Interagency Task Force. The Filipino Nurses United is pleased with the plan as this would provide more opportunities for nurses abroad. However, they still want the removal of the deployment cap and let all Filipino healthcare workers explore employment opportunities in other countries.
So tingin po namin, meron sapat in terms of number. Ang problema po ay yung paghikayat ng gobyerno na magtrabaho sila as nurses po sa ating mga healthcare facilities.
The group argued that there are still around 200,000 nurses in the country who work outside their profession and earn below their salary grade. According to FNU, since the deployment cap was imposed, around 4,000 nurses were not able to process their documents for employment abroad. Ray Pelayo, UNTV News and Rescue. We serve the people. We give glory to God.
The Quezon City government opens a COVID-19 vaccination site after working hours. Meanwhile, Mayor Belmonte expects a better online registration system for the vaccination program by Friday. Asher Kadapan Jr. details why live. Yes, Asher.
Harleen, Quezon City Mayor Joy Belmonte recognizes the call of several workers in the city aiming to get vaccinated against COVID-19 but cannot take off work or don't have time to visit a vaccination site during office hours. With this, the local government unit launches tonight the QC Bakuna Nights, which runs from 4 p.m. to 9 p.m. or after the normal working hours. This is scheduled to continue until Saturday, exclusively serving the essential workers included in the A4 priority group in the COVID-19 vaccination program of the national government. It targets to vaccinate 2,000 economic frontliners each night. According to Quezon City Task Force Vax to Normal co-chair Joseph Wico, they plan to continue this activity next week with an extended hour until 11 p.m.
Ito yung mga, for example, pag umalis sila, baka mabawasan sila ng sweldo dahil daily wage earner sila. So with this approach, ginawa ni Mayor Joy Belmonte na mag-isip ng paraan para at least yung mga taong pwedeng pumunta sa vaccine site after office hours, meron silang pupuntahan.
The workers, on the other hand, expressed their appreciation to the efforts of the Quezon City government in the fight against the pandemic.
Pag umaga kasi may klase kami hanggang alas 2. Tapos yung bakuna, ngayon naman maganda yung panahon, medyo malamig konti. Kaya kami, okay na okay po yung ginawa nilang oras. Saktong-sakto po.
Yun ang na-appreciate ko talagang yung effort ng Quezon City Hall talaga. Gumawa sila ng paraan para mabaksin ang lahat. Yun ang nooka. Kasi hanggang anong oras? I think hanggang 9 p.m. sila, hindi ba? O hindi ba nakakatuwang malaman na talagang they do their effort, their best para mabaksin ang mga tao, hindi ba?
Meanwhile, the Quezon City government said it is seriously considering terminating its contract with Zuwelig Pharma Corporation, the firm behind Easy Consult. Mayor Belmonte said she has issued an ultimatum to Zuwelig Pharma Corporation to upgrade its system and provide all the deliverables by Friday, June 18. The local chief executive made the pronouncement after residents reported problems in accessing Easy Consult services since March 27. In addition to terminating its deal with Zuwelig, the Quezon City government is also mulling suing the company for damages if it fails to meet its contractual obligations to the local government by Friday. Harleen, Mayor Joy Belmonte, however, explains that Easy Consult also gave their commitment in getting their system fixed by Friday, and so they expect that the online registration will be better by then. Harleen?
All right, thank you so much. Asher Kadapan Jr. reporting live. The Department of the Interior and Local Government, or DILG, remains firm that local government units should follow the policies set by the national government. This was after Cebu Governor Gwendolyn Garcia said during the Senate Committee of the Whole hearing that they uphold the provincial ordinance about its own testing and quarantine protocols for returning Filipinos, unless a judicial court says otherwise. The Cebu province swabs all arriving Filipino passengers immediately upon arrival, followed by home quarantine should the test yielded a negative result. This is contrary to the IATF policy that requires a 10-day quarantine before undergoing a swab test on the 7th day. Governor Garcia added she will ask the provincial board to revisit the ordinance and that they will invite the medical experts of the IATF to discuss the matter.
And for the news abroad, the new Israel government deployed its first attack on Gaza after the ceasefire ended. Marvi Delfin tells us the details live. Marvi?
Kath, after Hamas militants released incendiary balloons into Israel territory on Tuesday, igniting fires, according to Israel Fire Services, Israel attacked back and deployed air raids to Gaza on early Wednesday morning. These major attacks have been the first in the 11 days which the ceasefire between the two ended. It has also been the initial attack of violence by Israel since the new government of Naftali Bennett. The air attacks targeted the Hamas military compounds located in Khan Yunis and Gaza City, where the attacks originated from, stated by Israel Defense Force. There were no updates on whether injuries were implicated. The raids lasted for 10 minutes and scared civilians near the area. As per the Israel Fire Service, the incendiary balloons had set off at least 20 fires in the fields by southern Israel. In response by a Hamas spokesperson, they stated that the Palestinians will continue brave resistance and defend their rights and sacred sites. Kath?
All right, Marvi, thank you for that live report from Australia. Two major cities in the United States lift their COVID restrictions just in time for summer. Maeve and Dog will tell us the details live. Yes, Maeve?
Kath, New York and California victoriously announced on Tuesday that the coronavirus restrictions on businesses and gatherings will be lifted as the two states hit their vaccination milestone. According to New York Governor Andrew Cuomo, as 70% have received at least one vaccine dose, the pandemic restrictions will ease and his state will return to normal. Meanwhile, California Governor Gavin Newsom declared Tuesday as Grand Reopening Day and announced at the Universal Studios Hollywood a $1.5 million lottery prizes to people who have been vaccinated. The said states will lift the limitation in gatherings and there will be no need to stay 2 meters apart. But businesses should still abide by the health and cleaning protocols, and unvaccinated people are advised to wear masks and maintain social distancing. However, amid the easing of restrictions, the United States has a grim reminder as COVID-19 deaths have reached 600,000, despite the vaccination rollout efforts of the country. President Joe Biden admitted that despite the decrease in the new cases and deaths, Americans should still be alert. Kath?
Thank you, Maeve and Dog, reporting live from Australia. A ship guided by an artificial intelligence-powered captain prepared to sail across the Atlantic Ocean but won't be boarding any passengers. Del De Castro reports why.
The Mayflower autonomous ship is planned to cross oceans later on the week, leaving home port from Plymouth, England. This will sail through the Isles of Scilly over the site of the lost Titanic to Plymouth and Massachusetts, just like how the maiden voyage of the first Mayflower ship 400 years ago. Instead of carrying English pilgrims or any passengers at all, the Mayflower will be run completely by artificial intelligence developed by IBM Watsons for experimentation purposes, designed without sleeping quarters, a galley, or even a bathroom. Mayflower will have the ability to study sea levels, measure wave height, and gather water samples for testing at regular intervals throughout its voyage. On board will also be a holographic microscope that will sample for water pollution, specifically microplastics measured at 5 millimeters or less that are highly harmful for marine life. IBM claims that this technology could possibly be a tool in assisting crewed vessels navigate through difficult situations and facilitate low-cost exploration of the oceans that cover 70% of the Earth's surface. Del De Castro, UNTV News and Rescue. We serve the people, we give glory to God.
And those are the reasons behind the news in other parts of the globe. I am Kat Dumaraos, live from Bangkok, Thailand. Good evening.
The wearing of face shields, either indoors or outdoors, is still mandatory. But according to Treatment Czar and Health Undersecretary Leopoldo Vega, this can be limited to some individuals working outdoors. Aiko Miguel explains why.
A little consideration should be given to some individuals on limiting the use of face shields, especially if it hinders them to work properly. According to Treatment Czar and Health Undersecretary Leopoldo Vega, some workers experience inconvenience when working while wearing face shields, like carpenters, couriers, and car wash staff.
Mga face shields, kakailangan naman talaga yan pag nasa indoor ka, pag nasa mall ka, or pag may interaction ka na face-to-face inside. Pero pag nasa outside naman kasi, alam naman natin ang risk of transmission is very low. At lalo-lalo na pag naglalakad ka lang sa kalye o kaya nagtatrabaho ka kasi mag-affect yung moist nito. So pwede nyo tanggalin ho yan.
Health experts have been stating that wearing a face mask, face shield, and observing physical distancing can give 99% protection to an individual, according to Department of the Interior and Local Government Undersecretary Jonathan Malaya. Wearing of face shields remain to be part of the health protocols in the country to avoid getting infected with COVID-19.
May I just emphasize this to our local government units present. Even if nagbabago po ang ating community quarantine status, hindi po ibig sabihin nagbabago rin yung adherence natin to minimum public health standards. Kahit po maluwag na, kahit mag-new normal na tayo, hindi po talaga mawawala yung social distancing, face masks, face shield, even po yung face shield, no? That is going to be part of the new normal. Our vaccination efforts, ventilation, social distancing, lahat po yan is expected to be enforced until the pandemic is officially over.
According to DILG's report from June 6 to June 13, 2021, over 67,000 have been recorded health protocol violations in the country. 51,607 of these are violations of not wearing a face mask and not observing physical distancing, with over 15,000 violators. Aiko Miguel, UNTV News and Rescue. We serve the people, we give glory to God.
A medical depot in Quiapo, Manila opened its branch with a unique 3-in-1 concept. Aside from medical supplies, it also offers a pharmacy and a convenience store all in one shop. Marvin Calas reports.
To make all medical assistance and other basic needs closer and accessible to the public, a new concept or a 3-in-1 medical depot in Quiapo, Manila was made available yesterday on its grand opening. According to the company's CEO, the expansion of their physical stores aims to aid the medical needs brought about by the pandemic.
This pandemic was an eye-opener for us. This is a wake-up call that our fellow countrymen needed our services to be more accessible. Kami po, dito sa Medical Depot, we want to be part of the solution. So how? By aggressively expanding our e-commerce and expanding our physical stores nationwide.
Aside from a cheaper but quality medical supplies and equipments, a pharmacy with complete supply of medicines is showcased in the shop. It also includes a convenience store where the basic needs of the public is made available.
We are catering not just medical supplies and medical device. We are also catering pharmaceutical products, generic and branded medicine, OTC products, personal care, of course laboratory and dental products. And for our community formats, we also have a convenience item. We're not just the typical medical shop, we will be your one-stop essential shop.
Medical Depot made its name as one of the most trusted medical supplier in the country for almost 30 years. The company has 35 branches in Metro Manila and targets to open more shops in other provinces. Aside from their physical stores, Medical Depot also launched its online shop for customers who prefer online shopping, moreover to reaching customers in distant places. Customers can avail quality wheelchairs, hospital beds, nebulizer, personal protective equipments or PPE, and other medical supplies. The opening of the Medical Depot one-stop shop was acknowledged and supported by Manila 3rd District Representative Yul Servo.
Parang nilapit nila sa community yung ganitong klaseng negosyo. Dati sa pupunta ka lang sa bangbang, pinagsalo-salo nila na option. Parang pinag-isa nila lahat yung produkto para hindi na mahirapan yung taong bumili. Parang pagpasok mo dito parang lahat ng kailangan mo na dito na pagdating sa health, di ba?
The company also plans to open an online medical consultation for patients unable to go to the hospital. For interested customers, visit the Medical Depot website at www.medicaldepot.com.ph and their social media accounts. Marvin Calas, UNTV News and Rescue. We serve the people, we give glory to God.
The Commission on Higher Education plans to expand the courses allowed to conduct limited face-to-face classes. JP Nunez will tell us why.
According to Commission on Higher Education or CHED Chairperson Prospero de Vera, less COVID-19 cases have been recorded in physical classes allowed only in health-related courses. In fact, Only one case in Region 8 has been recorded. With that figure, they are now planning to expand the limited face-to-face classes to other courses which will require physical learning such as engineering, information technology, maritime, hotel and restaurant management or HRM among others.
Pero sa ngayon, itong mga degree program na ito ay sinisimulan na namin gawin yung detailed na guidelines. At nagpro-prototype na rin sila ng retrofitting para kung i-expand ito, madali nilang simulan.
But according to De Vera, this will still depend on the capacity of the universities if they can manage safe physical classes. 73 universities have already been allowed by CHED to conduct face-to-face classes, but the Commission is still inspecting colleges.
Tinitignan muna natin ang datos doon sa unang batch. Kung makikita sa datos na talagang ligtas ang mga bata dahil sa compliance sa guidelines, ang aking gagawin ay pupunta kay President Duterte at hihingan ng approval na i-expand dito sa iba pang degree program na kailangan din ng face-to-face.
Meanwhile, the Commission says that most of the students and professors from those universities were already vaccinated as they were considered as A1 priority group or medical frontliners. The Commission assures students will be safe if minimum health standards will be strictly observed. JP Nunez, UNTV, News and Rescue. We serve the people. We give glory to God.
And before we close, we will leave you with the final word, giving glory to God. From the book of Ecclesiastes, chapter 9, verse 4, it says, "For to him that is joined to all the living, there is hope. For a living dog is better than a dead lion." And those are the reasons behind the news, June 16, 2021. I am Harleen Delgado.
Reasons we deliver to you as they unfold. I'm Angelo Castro III.
And because we need to know, we will always ask why. I am William Theo. We serve the people. We give glory to God.